So hello everybody and welcome to our second Youth Mental Health Leaders webinar series. So this series is co-hosted with Mental Health America and GlobalMentalHealth at Harvard Initiative. And the purpose when Kelly and I came together to think about what we wanted to do for a webinar series is we wanted to bring together researchers, clinicians, and young people who are working with these populations and these groups that we want, that they are working with them to improve mental health, to discuss issues and solutions in youth and young adult mental health. So we are really excited to bring together the groups from Mental Health America and their work, which is driven by a commitment to promote mental health as a critical part of overall wellness, including prevention services for all, and early identification and intervention for those at risk, integrated care services and support for those who need it, with recovery as the goal. And I am with Global Mental Health at Harvard. So work is focused on research and policy and advocacy. So for our initiative, we are aiming to inspire members of the Harvard community and beyond to elevate profile mental health as a fundamental public good and universal human right. So as you can see, we have a lot of similarities. So we're excited to bring together groups who are doing this work all over and hear about their work. So I am really excited to introduce our panel today. So as you all know, because you've joined us, this second webinar series is about LGBTQ plus youth mental health. And we are bringing together Georgia Messenger, Ari Sokolov, Juan Acosta, and Dr. Anna Progovac. And I'll read a little bit about their bios before I pass it off, and then they will do the majority of the talking. And so Georgia is a 21-year-old founder and activist who's current co-founder and COO of the Trill Project, an anonymous and safe mobile application for mental health peer support, which we'll be hearing more about in this call. Originally from Los Angeles, she is a member of our community. Georgia is a rising senior at Harvard University studying psychology and computer science. We have a little bit of both with Georgia. In addition to social impact technology, she's passionate about venture capital and supports Black founders seeking funding for their startups through her role at Balance. Ari is a 20-year-old founder, designer, and developer that has won national and international awards from the National Center of Women in Information Technology, the US Congress, South by Southwest, Target, and Apple for her work. Currently, Ari is a co-founder and CEO of Trill Project, a mental health application with over 75,000 users. She is also a contributor to mental health technologies in the open source community and an advocate for minorities in STEM. Juan Acosta is an award-winning LGBTQ plus mental health advocate who serves on national committees, speaks at conferences and festivals, and is a New York Times best-selling author for a book co-authored with Lady Gaga, Channel Kindness. He drafted a historic LGBTQ plus proclamation for his hometown of Woodland, California, and currently serves as one of the regional managers for the Call Hope Warm Line. And then as a part of this series, we bring a researcher or clinician from Harvard to moderate the panel discussion. So I'm thrilled to introduce Dr. Anna Progovac, who is an instructor of psychiatry at Harvard Medical School and a senior scientist at the Health Equity Research Lab at Cambridge Health Alliance. Her research focuses on improving the quality of mental health care in the US with a focus on reducing disparities for underserved populations. Dr. Progovac's projects use a variety of research methods and community-engaged research. She is interested in approaches to improve mental health that spans across systems and therefore enjoys collaborating with students, community members, other researchers, clinicians, administrators, and policy advocates. She is currently the primary investigator on a National Institute of Mental Health RO3 Award and past recipient of a Harvard Catalyst Health Disparities Pilot Award, focusing on measuring and reducing mental health care for gender minority individuals in the US. She's also a recipient of the Harvard Medical School Department of Psychiatry Kaplan Award to conduct a mixed method analysis of an implementation of a behavioral health home for patients with serious mental illness, as well as a potential for dissemination to additional sites within Cambridge Health Alliance. So before we pass it off to them, who will lead us through, we can go through some housekeeping. Sorry, that was a slide before. So just so that everyone knows, you're muted and unable to turn on your microphone. The session is being recorded, and Kelly will have that link for you from Mental Health America. And we are providing closed captioning, and that can be enabled at the bottom of your screen. If you need help with that, let us know. This does not offer continuing education, but you can receive a certificate of attendance from the link emailed with the recording. Please use the chat box. We want to hear from you, but as Kelly wrote, put your questions in the Q&A box so that we can, we can share them with all and answer them directly. They don't get lost in the chat that way, okay? And then when using your chat box, make sure it's set to general or all panelists and attendees so that you can see all of us. And without further ado, I would like to pass it off. Kelly, did you want to do an introduction with us, or we'll have them pass it?
So I'll just check in. Hi, everybody. I'm Kelly Davis. I use she, her pronouns. I'm the Associate Vice President of Peer and Youth Advocacy at MHA. I'm super grateful to be here with y'all today and hear from the participants. So without further ado, I'll hand it over to Anna, and she can go ahead and get started.
Thanks, everyone. Hi, my name's Anna Progovac. I also use she, her pronouns. I'm going to be kind of facilitating the panel discussion today, but the focus is really on these other panelists, and my role is more to kind of lobby questions and keep the conversation going today. With that being said, I was kind of reflecting on a conversation I had with some of our panelists last week, kind of preparing for today, and thinking about their stories of why they got into this work and what it's meant to them. And I thought I would just share why I got into this work briefly, because I think this work is personal for everyone. So while I consider myself an ally, I don't personally identify as LGBTQ+. I got into this work because a longtime friend of mine who I became friends with in high school, who was a little bit younger than me, and who had for a long time struggled with mental health issues, one day, told me that she was trans and was in the process of not only, learning about all the healthcare available to her, but also navigating all of these health systems now as a person who's trans. And so my kind of initial effort to do research in this area really stemmed from listening to her talk about just very simple things that became much more complicated for her in the health system, and then also with her mental health care. And it struck me that there really was a lot of new information coming out, but there were lots of gaps in research in this area. And I think a theme that we will explore together in this panel is also, what's available in the kind of traditional mental health types of systems versus what's really missing. And I think you'll see that some of this, what's really missing, is being filled in by the work that our other panelists are doing. And then I'll just, before I start the questions, I'll just share kind of two quotes from community members that were shared with us during a session where we were sharing some of our data about suicide risk and violence victimization risk, and asking people of all ages in Cambridge, Massachusetts, who identified as trans or non-binary, what were some things that we might be missing in our research, or that we really needed to know from them about these issues. And one thing that a younger participant shared with us was how important access to transition-related care was for them. They said, at the time that I was really kind of at my lowest point, the only thing I was living for at the time was to transition. And there were all these barriers being put up because they also used substances to prevent them from being able to get their transition-related care at the time. So the system becomes very complicated very quickly. And then the last thing I'll say is, we were sharing these statistics about suicide risk, and I know some of those were shared in the summaries of this panel. And we were finding much higher rates of suicide risk for trans patients in the Cambridge Health Alliance community. But even those much higher rates that we found for trans and non-binary patients compared to other patients at CHA seemed far too low for one of our participants who said, you know, all my friends have attempted suicide. All my friends who are trans have attempted it at some point. And it just really, I think, hits home, you know, even with the data that we see, even with the research that we see, there's a lot going on under the hood that we just don't understand yet. So I'm excited to lead this conversation, or really just to facilitate this conversation with our panelists about all the work that they're doing to really make a difference in this critical area. So with that, I'll start with questions. And the first one that I would love to hear from everyone about is just to start by sharing a little bit about your work and then why you got started in this area. What was the kind of origin story for the work that you all are doing? And I'll leave it up to you guys to decide which order to go in and see if that works okay.
Great. Well, I'm Juan Acosta and my pronouns are he, him. It's great to be here with everybody. My work really focuses on intersectionality within mental health. I got started due to my own lived experience. My own lived experience is the catalyst of my work today. I came to this country at age 2 from Mexico, and I had to learn how to navigate numerous systems. Oftentimes growing up, I didn't feel like talking about my mental health due to the stigma in my culture and due to me not wanting to be out to my parents yet. I identified a need for more representation within the mental health care system, more intentional resources for people. And I've oftentimes heard about the need for representation, and it's something that would have definitely benefited my own mental health when growing up. So it's something that I'm trying to ensure. I currently serve as the regional manager for the CalHope Warm Line, which serves the whole entire state of California. And I genuinely believe in peer support and the power that peer support has for one's mental health, because you're able to talk to someone who's been there before. There's no hierarchy, and you're able to sometimes find that representation that you so need, someone who's been there before, and that makes you feel like it's going to be okay.
Thank you, Juan. And Ari and Georgia, do you guys want to go ahead? I don't know if you want to go together or individually.
Sure, I can start and Georgia can add. So I started Trill in my last year of high school, and pretty much after hearing about my best friend, she told me about how she had struggled coming out as an LGBTQ plus teen in our own community. And it was really shocking to me just because we lived in Los Angeles. It was a really liberal environment. I thought personally that a lot of, individuals wouldn't necessarily have the same amount of stigma that we kind of hear other parts of the United States. And at that same time, I was participating in a competition with my Girls Who Code Club that challenged young girls, I guess in high school, to create apps that solve social problems. So kind of with the inspiration of her story, went in to ultimately see how I might be able to help, LGBTQ plus teens in my own community feel safe and at home, and consequently, discovered that, as you mentioned before, like 40% of trans youth attempt suicide or reportedly, and the rates for LGBTQ plus teens in terms of mental health are just a lot higher. So ultimately found that, the solution that we came up with, by integrating LGBTQ plus teens was a virtual peer support platform, which is the Trill Project now. And so we're pretty much an anonymous social network for mental health support that provides peer support and mental health resources for anyone who comes on it, but originally started and really cultivated with the intention of helping LGBTQ plus teens.
Yeah, I think Ari summed that up beautifully, and I see the love for peer support in the chat. Ari and I also, both in high school when we met, were in peer support clubs ourselves in person, and figured why not use our power as computer scientists to replicate that support that we had benefited from on a massive scale virtually with people all across the world. And it's been such a gratifying and rewarding experience to be able to see not only LGBTQ plus teens, but also allies and people of all walks of life finding community and making new friends on our platform.
Thank you all. And it's very clear that the theme here is, peer support as well as representation. So one of the things that came up as we were thinking about what to focus on today was this piece about the difference between just working on increasing access to, let's say, traditional types of mental health services versus what's really unique about this peer support, both in person and your virtual platform. So I'd be curious if you all had a perspective on what is peer support, and in particular, peer support that is for people of your age or of your location or of your background. What does that offer that people can't otherwise get from maybe a therapist in a traditional way?
I believe it provides that opportunity to talk to someone who's been there before, and you're building that rapport with the community because it's people who look like you who might have gone through similar experiences. Increasing access is one thing, but if we're replicating a system that hasn't been working, that's been operating on a one-size-fits-all, it's not productive. And I believe we need to be proactive. Oftentimes, young people, especially LGBTQ plus people, do not receive support until they're in a crisis. People wait until they're in a crisis point, and it's oftentimes not by choice. For many young people of color within the LGBTQ plus community, mental health and taking care of it is a luxury because they are fighting every day to survive, to meet their basic needs, to meet whatever other systemic injustice they're fighting against. And I believe that peer support provides that opportunity. It's more accessible. People can call Warmline, people can access a hotline or a chat line, and it bridges the gap that oftentimes money to go to a therapist it's difficult for people to do. And it's the reality of many people with my reality, and that's why I believe peer support is powerful for young people.
Thank you, Juan. Georgia and Ari, did you have other pieces to add to that you want to share?
Yeah, I think just kind of from, anecdotally, seeing the users on Trill being able to, find this community, you often see, I think, with a lot of LGBTQ plus teens that, especially, aren't necessarily out to their parents or, have other difficulties at home, kind of justifying that you want to go to a therapist, especially for those that are, supported by their parents, is kind of more of a difficult situation. So ultimately, having those, communities where you're able to express themselves is a lot easier for a lot of, younger teens. And ultimately, I feel like there also are other users on Trill who use a combination of, therapy and also peer support as well. And being able to, just have other peers that, relate to you and being there, no matter what, has definitely, also been very beneficial. And, we found that there are studies that find that those who use peer support experience 2.9 fewer hospitalizations than others. So it's definitely a powerful tool that's, been studied and to be very effective.
Thank you. Georgia, I wonder if you could tell us a bit more about what the peer support looks like on the Trill app for people who might not be familiar with the app, just some concrete examples. Is it, an anonymous chat room? Are there specific ways to create subgroups, or what does it look like in the sort of real sense?
Yeah, most definitely. And for those that aren't familiar with the app, definitely go ahead and download it. Trill Project, TRILL, on Apple and Google Play Store. But we really designed every step of the way intentionally and collaboratively with our community. So we've always had a very robust beta tester group of key super users and super fans that are providing feedback and giving us guidance as we build. And the way a user journey works is you download the app and there's very low barriers to entrance. So all we ask is an email address and password, and it's totally free to sign up. So automatically creating a really safe and confidential space to replicate what you would get in a therapy session. From there, you choose a color, which determines your anonymous identity. This color selection was at first a kind of mirror to the LGBTQ plus rainbow or pride flag, and colors are one of our most popular features. So they're really fun ways to customize your identity, and you can change them any step of the way and also unlock new colors as you increase your support score, which is determined by how active you show up in our community. From there, there's a feed that you can post either a text-based post on, answer our daily question or ask a question. And you can curate your feed either just by a basically chronological feed where there's no weird algorithms or influencers or prioritization of anyone's posts. Everyone's posts are seen equally and get same amount of transparency and visibility on the feed. Or you can sort your feed based on the support groups that you join. So our most popular support groups are LGBTQ+, relationships, anxiety, and high school. These support groups are totally user created, so some have surprised us, like the support group Poetry. We didn't create Trill with the intention for people to be sharing art per se, but the users have guided it in that direction, and it's been really beautiful to observe that sort of natural trend. And then you're also able to enter into private messages with users as well. There's trigger warnings as well, and snaps and comments, and then moderators and machine learning on the back end working to make sure that the posts remain supportive and connecting any posts that may indicate a user is in harm with crisis resource partners that we work with.
Great, thank you. I think that's really helpful for people who haven't gotten the chance to download the app yet. And Juan, could you tell us a little bit more about the warm line features, just again, so everyone kind of knows what the different types of peer support that you all are helping to promote and run are on the call?
Yeah, so the warm line I work for serves the entire state of California. It's open 24/7, 365 days out of the year. It's available through phone and online chat, and it's ran by the Mental Health Association of San Francisco. There's warm lines throughout the nation, and these are lines where you call and you're connected to a peer support counselor and you're able to talk about whatever you're feeling in that moment. Oftentimes we hear about people's concerns around COVID, and we can connect them to a resource in their community. I believe that's how you bridge gaps. If people don't know where to go and they're taking that first step to call a peer support counselor, they're able to get a resource that they might not have been able to get prior to that. And it is confidential. It is, as I said, open 365 days out of the year, 24/7. So we're always available for support.
Thank you all. That was really helpful to hear the specifics. And I'd like to shift the conversation a little bit into, as opposed to thinking just peer-to-peer and engaging within people of the same age group, thinking about what it looks like to have intergenerational allies. And this is something that we spoke about a bit leading up to today. What does it look like for someone who came out 20 years
working with Gen Z communities to check a box, but actually giving these underrepresented communities a seat at the table. So whether that looks like creating an advisory board, building with a beta tester group, doing research where you're not just using LGBTQ plus Gen Zers as test subjects per se, but designing the research questions with them and making sure there's transparency every step of the way. It's obviously easier said than done, but hopefully, learning about the different innovations we're working on for anyone in the audience that's been trying to build something like this. There are tons of capable minority students and LGBTQ plus Gen Zers and activists and allies who want a seat at the table and are excited to get their ideas represented in the change that's being, conveyed in the classroom and in the workforce. I think more tangibly, would be really interested, maybe Juan, you could speak to this as well, maybe more like the experience of coming out to parents or like to mentors or older people in life and how those sorts of people can be allies. It's not something I have like direct experience with, but I would be curious to hear your perspective on that if you have anything.
Yeah, of course. I mean, for me, coming out was quite an experience. Growing up, I had built up a huge wall, a barrier with my parents because I was ready for them to kick me out when I decided to be myself. But I knew that I wanted to be my unapologetic self regardless, and even if it meant not talking to my parents anymore. However, when I did come out to them, they both gave me a kiss on the cheek. They loved me no matter what, which was a great experience for me personally, but I know it's not the case for many people. And growing up, I did hear a lot of homophobic comments from my cousins, just a lot of derogatory terms. And I believe that once they were able to see beyond my label of my sexuality, when they saw my humanity and they realized that I was still the same person, no matter what or who I was, they were able to have a change in their mindset a bit. Because oftentimes what I've identified is that people don't have a conversation. They talk at one another, they point fingers at one another, and it's not productive and it's not healthy. But when you're able to truly listen and want to learn from one another and get to know each other, you're able to have a different perspective in life. And when we talk about intergenerational allyship, I believe that there's many struggles that Gen Z, gay marriage is legal now, but there's still a lot of discrimination in numerous states. And there's still a fight for LGBTQ plus rights throughout the states, and it's something that hasn't gone away. I love what Georgia said about tokenism, because oftentimes young people are used as tokens to check off a demographic box, to meet a grant. They are promised safe spaces, but what makes a space truly safe? Because a poster with butterflies and rainbows does not make a space safe. So what are the metrics that we are using to ensure that those spaces actually feel safe for the young people we're inviting on? I believe that when we come together, we're able to create the most change, and there might be differences, but I believe that if we are truly trying to support the LGBTQ plus community as a whole, we have to take ourselves out of it. And we have to fight for everybody. When there's trans women of color who are being murdered at such high rates in this country, that means that the fight is not over. And me as a cis gay man, I have to fight for them too, because not only because it doesn't directly impact me as a person, doesn't mean it doesn't matter, because it matters. And if we're a community, we have to stay united and we have to fight for the community.
Thank you both. I'd like to just follow up on something that you touched on, Juan. I think that also a lot of what you were saying, Georgia, made me think about, which is I'll say both in, let's say, mental health spaces, school spaces, let's think high school and college, and also research spaces in terms of trying to get actual, representation in research studies, meaning helping develop research questions. What do you all see as sort of key pieces for people to think about when they think about creating safe spaces, truly safe and inclusive spaces? Because I definitely hear you. There's lots of almost like marketing take on trying to say, we're a safe space. We put up this rainbow flag, or we got this stamp. But I think there's just a huge disconnect sometimes between what does it mean to do that and what are you actually doing on the ground. And I'd just be curious to hear from you all if there are places where you see people misstepping, or sort of first steps that people aren't doing that I think a lot of people in this audience would also appreciate hearing.
I think the first thing is making sure that young people are being the key front and center of these developments, that they're informing these research, the programming, etc., and making sure that you're building a rapport. You just can't have someone give someone a flyer with, oh, here's this resource, and have no rapport with them. You have to want to meet them where they're at. You have to want them to walk them through it. Oftentimes, especially for underserved communities, they might not even know the simple terms that we know as people in the field. They might not know what depression looks like, what it feels like. And I believe if we start from that macro level, you're able to build a rapport and you're able to have more people want to be involved in creating these resources, research, etc.
Yeah, sorry. To kind of jump on that, I think that we've definitely gotten like really similar things, in terms of at Trill. We started Trill by pretty much just creating a post on Tumblr where there were a lot of LGBTQ plus teens just asking what teens would want in a safe space. And from the beginning, have really kind of centered our app around co-creation which definitely is a huge, I think, element of really creating meaningful, impactful, safe spaces for LGBTQ plus teens. Even when our app, like at the very beginning, we were just high schoolers and still learning, you know, how to build things, was like crashing and like didn't have a lot of, you know, technical, you know, experience, was able to, you know, connect with users. They were constantly posting about like how they wanted comment features, how they wanted DMs, how they wanted trigger warnings, and ultimately, you know, we added those into the app because that's what, you know, the LGBTQ plus community told us that they wanted. And because we were always there and telling them that we were, you know, hearing them and creating this space that, you know, was really significant for them, was really helpful, you know, ultimately to, you know, create that meaningful, safe space. Now I think that we've grown, and obviously that was like a group of 1,000 users to now we have, you know, a lot more. We've created systematic, you know, research processes to ultimately make that co-creation more systematic. Ultimately, you know, we're organizing a beta tester group that we engage, you know, through surveys and other methods of research with like user testing sessions and that sort of stuff. And then have consequently, you know, we do like a yearly survey where we ask, you know, the community what they want in Trill and how we can improve, and that dictates, you know, how we ultimately, you know, create the app to make sure that it's most meaningful and safe for all users. And that informed our moderation and the machine learning that we ultimately added in to allow like recommendations to pop up for more, you know, like crisis support lines and whatnot within the app. And that's been a super helpful, you know, insight. And I think, as Juan said, is just, you know, very central to creating a safe space for LGBTQ plus teens.
I agree 100% with everything that's already been said. I would also say, like, kind of the two main pieces of advice I would have for anyone who's looking for a way to be more supportive of marginalized communities is the first would be to, for companies like at a macro level, almost is to like put your money where your mouth is, right? So it's like they're so nice to see all the rainbow logos and like branded things on shelves at stores right now. But it doesn't mean anything if you don't have healthcare that's also inclusive of LGBTQ plus communities, if you're not paying your workers a living wage, if you're not supporting education in classrooms that's going to teach about diverse sets of people and have reading lists with not only just white male cisgendered authors, but having, you know, different voices being heard. So actually making big level changes like that. And then in our personal lives, like, yes, if you go to a Pride festival or wearing a rainbow during Pride Month, it's lovely and that's nice, but make sure on a micro level for yourself, are you asking people's pronouns? Are you respecting those pronouns? Are you asking your LGBTQ plus friends and checking in with them when there's a headline about something terrible that's happening in the news, which is, you know, happening all too often nowadays? Are you checking in on your friends' mental health? Do you have friends that belong to these communities? And if you don't, maybe evaluate what kind of people are you surrounding yourself with, and are you just staying in echo chambers and insular communities and not making an effort to meet people that are different from you and understanding their stories? So that would be the first piece of advice. And the second would be to not be so hard on ourselves with falling into traps of like political correctness. I think there's a lot of people that get paralyzed and don't want to change or make change because they're worried of being scrutinized or saying something wrong. Putting in effort and doing that authentically is still something. And, you know, if you are maybe from a different generation or a different culture, or didn't grow up in a household or education system that was teaching you these things about like microaggressions or pronoun usage or anything like that, that's totally okay, and that's not by fault of your own, but how you move forward is by fault of your own. So if you're acknowledging when you do make mistakes, whether you're a company that, you know, put out a social media campaign that was tone deaf, or you're an individual who accidentally misspoke or said something offensive that you didn't realize was, it happens, and being okay with that and then being willing to forgive yourself and educate yourself and move on is really key too, because we're going to make mistakes along the way. We're not perfect, none of us, and we just have to be, I think, a little bit more forgiving of each other and making an effort to educate each other every step of the way.
Thank you all. And Georgia, something that you were touching on a lot at the end of what you were saying about the sort of the two first things you would tell people to focus on, I think leads really well into one of the questions we wanted to touch on, which was just, I wondered if each of you could reflect a little bit on the importance of taking intersectionality into account, especially when working with LGBTQ plus youth, but also youth who are LGBTQ plus and maybe BIPOC or communities of color. And maybe someone, if someone could paste in the chat what that stands for, just so everyone has that abbreviation too. I know, Juan, that's something that you've been talking about as a focus of your work. And I'd also be curious, Georgia and Ari, what has come up in the Trill app, or what ways that people have kind of helped each other think about, talk about, support issues of intersectionality. So I'm interested in hearing from you guys. Thank you.
Yeah, for me, as I mentioned, I came to this country at age 2, and it was difficult being a part of both. I didn't feel like I belonged to the LGBTQ plus community for a while because I didn't feel like there was representation for the struggles that I was going through on my day-to-day life. And for my culture, I didn't feel like I belonged to my culture because being myself authentically was looked down upon. It was shameful. It was something that I needed to hide. That seemed like it was an abomination to my family. I remember I used to pray sometimes that I didn't want to be who I was. And it just made me feel really bad. It made me feel sick to develop anxiety, depression due to the way I was feeling. I felt like I didn't belong to either. So it was a very difficult situation, but it was until I began being my authentic self that I was able to get on that road to recovery with my own mental health, and to be able to now do this work to ensure that other young people from underserved communities, from immigrant backgrounds, people of color, are now able to have some sort of representation. I'm not saying that I'm representing a whole community, but I know that people have gone through similar experiences that I have, and that I am now able to have a platform like the one I do today to reiterate the importance to bring people to the table, to talk about not just their struggles, but their hopes for change, and to make sure that we're holding institutions accountable for those hopes, not just to stay at a hopeful place, but to be actionable steps, to make sure that we are changing and challenging the system, because oftentimes these ideas are named radical, but there's nothing radical about wanting better mental health system for everybody. There's nothing radical about making sure that we are saving as many young people's lives as we can, and that we're making sure that access isn't just for a price tag, that there isn't just money being the front and center for access, that we're making sure that those children of color who might have to go home and take care of their siblings are able to take care of themselves as well first, to take care of their mental health, and that they're not awaiting years to get treatment. That's what I believe in.
Thank you, Juan. Georgia and Ari, is there anything maybe from your experience with the Trill app that you'd also like to share on that topic?
I think Juan summed it up beautifully. And yeah, I think, you know, at Trill, we designed what immediately comes to mind as an example is we designed our moderator education course initially with, you know, lessons around anxiety, depression, self-harm, child abuse, and different sorts of issues we saw commonly on Trill, and equipping our moderators with the language to then direct users to crisis resources. And this summer, one of our interns actually brought up to us, what about the nuances of how these different topics affect different identity groups of people? And we should expand our moderator education course to include more culturally sensitive and relevant interventions as well. So that gave us a moment to pause and reflect and think about, you know, who are we working with? Is there crisis resources that are specific for different populations of people that we can be plugging, you know, because trauma carries across generations and identity groups, and there's tons of research to support that too. So it wasn't something we had initially focused on at Trill, and we're really glad when one of our team members brought that up to us, and have since expanded our moderator offerings.
Great, thank you. I have a question that maybe you could think about from two different ways. So the question broadly is kind of how does tech or how does technology factor into the ways that you all are helping bridge the sort of mental health needs for the LGBTQ plus community? And maybe I'll ask you to think about it in two ways, because I think originally at the initiation of some of your projects, there is sort of the sort of getting feedback or advertising using tech, using social media. But then there's also this sort of what does tech enable as a response, including, you know, a whole different platform that wasn't available, you know, maybe 20 years ago or even 5 or 10 years ago. So I'd be curious for all of you how you see, you know, the role of tech, you know, the good and maybe some things that we still need to work on in certain spaces. And I'd just be curious if you all have any thoughts about that.
I love technology. I believe that, especially for the LGBTQ plus community who might be growing up in a small town, they don't have that representation, and finding a safe space online is all they have. So I believe that technology is great for that, and it bridges that gap. Throughout my work in the past year, we've been able to provide peer support groups, events like the ones we're doing today, for many people who otherwise might not be able to access such things. And I believe technology is able to bring more accessibility to people throughout the world, and it helps build those safe spaces online. However, there is that caveat, right, that it might also bring a lot of negative emotions. We've heard about the impact of technology, social media on people's overall mental health, as well as the constant comparisons, the perfect illusions that people are, you know, fabricating on the web. And I believe that is an area of opportunities for growth and making sure that every single app is truly safe for everybody online.
Yeah, I think to, you know, add on to that, you know, what I think our Trill's larger vision is to make the internet a safe space where everyone feels that they belong. And I think definitely in the work with Trill, something I've seen kind of is a major place that, you know, can expand is we personally, you know, use the data that has been post-reported by our moderators and ultimately categorized our moderators to create like a machine learning model that detects users that might indicate that they might be willing to harm themselves, might be willing to, you know, someone else is harming them or thinking about harming somebody else, and have been able to, you know, ultimately use that model to direct those users into appropriate crisis resources that Trill can't provide, you know, as a peer support network, because obviously you need, you know, more immediate attention. But ultimately, I think that there's a major place for other social networks to adopt similar technology and have, you know, found partners that are starting to do that. But definitely think that's a place where technology can go in the future. And then secondly, have been able to kind of rank the severity of a lot of those posts. We know that a huge issue, you know, in a lot of professional facilities that have high volumes of callers is, you know, prioritizing those that, you know, are more in crisis. We've seen like that a lot of, especially like with the VA and whatnot, that a lot of, you know, individuals, you know, wait for care and can't get them because there's too much volume. And I think in the future, we can really use machine learning and other forms of technology to be able to make sure that those that need the most immediate care get it first, and see technology being really useful in that direction.
Great, thank you all. I think we're at time for my questions. So I think we'll open it up now to introduce some questions that were either posted in the chat or the Q&A link. I think Kelly and Juliana are going to help us with that.
So there is one about employment, how research shows employment can play a vital role in someone's mental health recovery. So how can employment specialists support LGBT plus community when looking for or maintaining employment? Is one question that came in. And the second one is, what is the warm hotline number that we can share with our youth?
She had sorry, Georgia, did you have a response to that one?
Oh yeah, the hotline number though, Juan, maybe you can just send that in the chat if people were asking for that.
I got you all.
With regard to employment, you know, I think it's like like anything, whether any space you're spending time in, whether it's school, work, your house, what we've already talked about in terms of representation and acknowledgement is really key. So representation, I think, in the workplace, in terms of seeing people who look like you represented in your organization and represented in leadership roles in your organization, it could be really alienating. In my experience, what I can speak to is sometimes being the only female identifying person in a room of leaders, and oftentimes the only female identifying person of color in a room full of leaders at a company. And, you know, until we start to fix some of the aspects of recruiting and retention that are at play here, I think what companies can do, even if you don't have people in leadership roles in your company who look like all of your employees, is try to bring in outside folks then. Maybe it's an investor in your company or a member of your advisory board. And if you don't have anyone who belongs to the demographics of your employees that's represented in your investment group or in your advisory board, then maybe you need to take a look at who you're taking your money from and who you're letting advise your company, and think about having your leadership team mirror your team of employees as well. And, you know, until that's perfect, bringing in outside people, whether that be experts that you work with or guest speakers, setting up affinity programs where, you know, maybe it's like lunch and learns or support groups. I think also a lot of companies are doing interesting things in terms of offering therapy included in healthcare plans, or more time for like parental leave for people of all gender identities, you know, regardless of how you had that child, and having sorts of resources like that integrated into the culture of your company. So representation, and then I forget the other word I used, but I think it was something along the lines of accountability, in terms of, you know, recognizing your workplace might not be perfect, and not depending on your employees to be educating you on all the nuances of what they're going through, but making an active effort to understand, you know, virtual work is hard, or being the only Black person or the only gay person in a leadership team can be hard, and acknowledging those challenges and then making an effort to make it easier, however it might be. And then, you know, obviously just hiring more people from diverse backgrounds at your company. That's the only way we're actually going to create long systematic change, is if we're bringing in more people from these underrepresented communities into companies.
Yeah, I guess just also to kind of add on to that, in terms of what we've seen on Trill, I think we've definitely had, you know, a lot of users post about, you know, not being, that are LGBTQ plus, being in work environments that are, you know, really toxic in terms of not being acceptance. And I feel like a lot of, you know, employment for LGBTQ plus individuals stem from not only just like having to find a job, but also having to find a job that's supportive and, you know, accepts who you are, and you're not, you know, going to work every day and, you know, hating every minute of it. So, you know, if you are in those positions of power, being able to, you know, ultimately provide work environments that are inclusive for everyone. And lastly, the other thing is we've also had, you know, many LGBTQ plus individuals who were like homeless and, you know, just like because they were trans and they were in a state that, you know, was not very accepting of that. Just also potentially looking at those applicants from a different lens of view, and knowing that they had a lot more challenges to overcome than, you know, other individuals that did not come from a similar background, and thinking of that, you know, in a lot of hiring process.
Yeah, and I'll add a link in the chat for those people who are in healthcare spaces. There's a Human Rights Campaign Healthcare Equality Index that, in addition to having lots of specific parameters that healthcare institutions should be working on for patients and their families, there is actually an HR component. And I know our organization was going through this the last couple of years of actually doing the work to see if we're meeting all of these criteria. And so I think in some ways you think like, oh, is this just checking boxes? You know, there are things about these sort of measures that obviously don't get all the way to some of the things that we were talking about here. Like, do people really feel included? That's something maybe this type of index doesn't pick up, but it raised important points. Like, does our own health insurance, we as employees in a health system, have, you know, access to coverage for things like transition related care if you're trans? And it's actually complicated. We found out it's not what we thought. So the fact of going through some of these types of checklists, perhaps there are others for other types of industries, but this one I thought for our industry was useful both on the patient-facing side and had a lot of attention to what is the environment for your employees, and do you have all these kinds of supports in place as well. And I wonder if there's another question that we should address.
So there's one here that asks how we should talk about LGBTQ+ and mental health when we are working with communities where English is not their first language. How should we bring about any cultural factors that might be at play?
I think starting by just naming it. It's okay to sit in discomfort. I believe that it's part of normalizing these conversations. It's part of making sure that we're eradicating the stigma. LGBTQ+ people exist in all cultures, in all languages, and it's important that we're naming that. It's important that we're starting a conversation. I know that these conversations can be challenging and it can feel uncomfortable to name it in a room of people, but LGBTQ+ people feel more uncomfortable walking out of their home every day if they don't feel like they're being embraced, if they're not feeling like they're being empowered by their community members, by their culture members. And I believe just starting the conversation is step one. I know, as I said, it can be challenging, but even if we start by planting a small seed and having that conversation develop into bigger and bigger picture frames, we're able to start building that change across.
I think I would add something that I've noticed that our organization does in general well is there's a lot of different mental health culture specific clinics. So I think being able to provide that level of, bringing in people who can help with sort of modeling and meaning setting up a model of care that works for those communities is really important in the healthcare space. And I imagine there's sort of a similar, a similar level of really, again, sitting down and co-creating what does this space need to look like to best help the communities that we're trying to reach. And so I would echo, definitely you have to address, open the conversation and invite this conversation. And also I would look around, there are lots of people who specialize in exactly the types of questions that that you're asking. And, how can you within your organization advocate for getting some of that expertise, run some stats. What are some of the numbers about the different language speakers and whose needs are not being met by what you have available? We have, in mental health and in psychiatry in particular, the sort of mismatch between who trains to be a psychiatrist and who, needs mental health care is huge. We have, yes, we have more women in psychiatry, but it's, most of our psychiatrists are white and speak English natively, even if they've learned another language as a second language. That's not really going to be enough to have, conversations where people feel comfortable. So definitely diversifying the workforce. And if it's not, if you can't hire a full-time person right now, there, I think, are ways to get consultants. There are lots of organizations. I know in Boston, at Fenway, there's a whole clinic available for people to go, but also lots of training, online trainings. They'll come and do local trainings with different organizations as well. So I think seeking out that kind of expertise in different ways to the level of resources that you can obtain is another kind of key point. Oh yes, thank you. And someone reposted the link. Thanks. We might have time for one more quick question.
There's one more. Did you have another one? Or should I read this?
Go ahead and read that one, yeah.
Okay. So what resources are available if individuals can't get support from their parents or guardians?
Yeah, it's definitely a tough situation to be in, but knowing that you're not alone and there are tons of other great support resources out there, and that's where technology comes in. obviously Juan's work and Trill, and within Trill there's crisis resources. Some of the favorite organizations we work with are Crisis Text Line, which you can text with, National Domestic Violence Hotline, and Love is Respect is the youth-focused branch of National Domestic Violence Hotline. JED Foundation has tons of articles and educational content online that we've pulled from. National Eating Disorder Association has a hotline. Trans Lifeline and Trevor Project are two great LGBTQ plus specific ones. And then, you know, a quick Google search in your zip code can give you a list of therapists near you and other organizations that might be close to where you live. We also work with a partner called Live for Tomorrow, and Live for Tomorrow has a feature where you can enter your zip code, and it will give you a list of geographically relevant crisis resources as well.
I pasted one additional link, the Fenway Institute, which is in Boston, also, as I was saying, has lots of online resources, so you don't have to be in the area necessarily to benefit from those. And it looks like we're about to wrap up, so I will stop talking. Thank you all so much. This was really such a pleasure for me, so I feel really honored to have been able to lobby questions your way. Thank you.
Yeah, thank you all so much. I don't know if folks wanted to have a last, I don't know, Georgia, don't want to cut you off if people want to add one more thing before we close out.
No, I would just say thank you all so much for giving us the opportunity to speak. I'm going to throw some links in the chat around Trill, and we would appreciate any support of our company, and we really appreciate the opportunity to get to share more with you all.
Awesome. All right. Well, thank you all to our panelists. Thank you, Dr. Anna and Juliana. And thanks everybody who has attended. As we mentioned at the start of the session, all people who've registered and all attendees will receive an email with the recording and a link to receive a certificate of attendance within the next week. But otherwise, thank you all so much. Awesome, following people on IG. Thank you all so much for joining, and I hope everybody has an awesome rest of your day, and feel free to reach out to the panelists directly.